Ladies and gentlemen, we're about to start the second session, which means we've got the raffle draw for this fantastic basket full of goodies supplied by our hosts, ICANN. Of course, you've got to be in the room to win the prize. Yeah. All right. Right, the first lucky winner, if they're in the room, is Michael Annan. Ah, congratulations. There we go.
God willing. Oh, geez, that's a hot mic.
I've got it here. And
Australian. There must be some Irish blood in you.
how do I say your last name?
Olmert.
Olmert. All right. I hope you're in there.
Well, I don't know how am I billing.
No. I'm just going to call you a leading expert in human animal.
That's right.
All right.
And Director of Research and Warrior, Canine Connection.
Ah, that's right. Ladies and gentlemen, we're going to start the second session. I'm going to hand over, it's the PTSD research study findings, and the facilitator is Meg Olmert, Director of Research at the Warrior Canine Connection, and a leading expert in the human-animal bond. So I'll hand over to Meg.
Good morning. Hi, everyone. Just can I echo Phil's incredible mention that I am so proud to once again be in the presence of the lost tribe of the human dog experts. We've never needed you more. Thank you for joining us for this panel discussion called Comparing Notes. And I think I have a slide about it. Oh no, it was already there. Oh, there you go. Somebody teed me up. Comparing notes. And we'll look at the 5 recent research studies that were done that show that training service dogs reduces the symptoms of PTSD. On behalf of this panel, a warm thank you to our sponsors who made it possible for us to be here. To Chris Diefenthal, an extra shout out for making sure that we all made it onto the stage today. And to my panel, thank you so much for joining me, because I'd be up here alone without you. So thanks, panel, and thank you all for your attention to this very important matter. Thank you, Phil Tedeschi, for sharing our vision of how much better a world can be with the power of the healing power of the human-animal bond. As this group knows, you can't change the heart of a dog without changing your own. So there you have it in a nutshell. My work is done, I can sit down now. Okay, I'm Meg Olmert, and when I first met Rick Yount in 2009, he told me about a program that he had created that was inviting service members and veterans with PTSD to train service dogs for other veterans. And he was telling me about the incredible social and psychological boost that they were all having that was affecting their PTSD symptoms. And I was amazed because I had just written the book on that subject. It was 2009. My book on the biology of the human-animal bond had just been published. And I immediately said those fateful words, "We have to study this." Well, sadly, the VA was not as enthusiastic as we were at that time, because we were ahead of our time on that. But I'm very happy, humans and dogs, to tell you the time has come. And we're here now to say, spoiler alert, we got it right. So that's nice. That's the good news. Over the last 2 years, several service dog studies have been done that shows that whether you're learning to handle your service dog that you're being partnered with, or learning to train a service dog for another veteran in need, it can affect your symptoms of PTSD. These organizations are the ones represented today in our study. They were the ones that these complex protocols were devised to ferret out the effective components of each one of these very different programs from across the country. Some of the significant program differences include the variety of dog breeds used, adopted dogs versus purpose-bred dogs, length of training times, differences in support tasks, one-on-one client training versus group training. So it's a wide variety. The differences in each program required a different protocol. But the one thing they do all have in common is that they found significant PTSD symptom reduction after training a service dog. Any subject that involves human subjects is tricky. If those human subjects are at risk, like the PTSD population that we serve, it gets difficult and expensive. Add 2 additional sentient beings to the formula, that being the trainer and a dog, and you have research that is not for the faint of heart. But we've always known that a lack of evidence is not a lack of efficacy. And so we soldiered on, and I am very happy to say that the research protocols you'll learn about this morning bring a degree of objective rigor that has been much needed and called for. Differences in the design of each study offer intriguing clues about dosage and delivery of the healing power of the service dog bond. For instance, what is the most effective ratio of training PTSD, of dog training to PTSD symptom reduction? Can training for other be as effective as owner-trainer models? Which service dog training models offer the most efficacy and, importantly, universal reach? Despite the significant differences in the 5 service dog training programs and protocols, all showed the reduction in PTSD symptoms that indicate that they are as effective or more effective than standard medical treatments being offered for PTSD right now. I just think it's really interesting that one of the comments that we heard so much in our program protocol was the participants saying they never knew they could have such a deep connection with a dog. These are all people who had dogs. Most of them had them their whole lives. And this is something that Phil was talking about, that you can make such a powerful impact on. You can open people's eyes to the eyes of the dog that is looking and waiting for that recognition. And you can show them a powerful and rewarding, mutually rewarding relationship that they never knew existed. It's a consciousness-raising effort, as if you didn't think you already had enough heavy lifting on your hands. Today, we have brought together program experts and the scientists who studied their programs to share with you the important findings that take us a giant step closer to establishing service dog training programs as evidence-based therapies. Please join me in welcoming Ryan Woodruff, the Director of Canine Programming for Clear Path for Veterans in Chittenango, New York. Dr. Dessa Bergen-Cico comes to us from Syracuse University, where she's the professor of the Department of Health and a coordinator of the Addiction Studies program. She's on the faculty of the Interdisciplinary Neuroscience program as well. And she's authored more than 40 scholarly publications, as well as her book, War and Drugs, The Role of Military Conflict in the Development of Substance Abuse. Bahesha Doan is the founder and training director of This Able Veteran in Carbondale, Illinois. Dr. Richard Hunter is the director of Clinical Outcomes Group, a national mental health consulting firm. Dr. Hunter provides psychological strength and resiliency training to SWAT teams, law enforcement, and veterans with PTSD. He's a founding member and past chair of the American Psychological Association Task Force on Serious Mental Illness. Brett Simon is the president of Canine for Warriors in Ponte Verde Beach, Florida. Brett is also team leader for their canine and warrior trainers. Kerri Rodriquez, is a PhD candidate at Purdue University's Center for the Human-Animal Bond. Her research focuses on the psychophysiological effects of service dogs for military veterans with PTSD, as well as with children with autism and individuals with physical physical disabilities, so there'll be lots of things to talk to Kerri about for all of you. Matt Decker is a Marine Corps veteran and licensed social worker. Really? Matt is a clinical director for Paws for Purple Hearts in Pen Grove, California. And Dr. Stephen Woodward is a clinical psychologist from the National Center for PTSD in Menlo Park, California. Dr. Woodward, as you'll hear, is engaged in a range of studies on the neurobiology of post-traumatic stress disorder with an emphasis on combat PTSD and veterans. Welcome and thank you all. Our program reps will introduce each study presentation with a brief overview of their program's philosophy and practical guidelines. And the study presentations will take approximately 20 minutes or less, followed by a panel discussion and questions from the audience. And I'm going to kick this off by wearing both hats for Warrior Canine Connection. Okay. Put that other hat on. Put glasses on. Despite the tens of millions of dollars being spent on veteran mental health care, the effectiveness of, oh, I bet I have some slides. Oh, there's our people. Here we go. The effectiveness of standard trauma treatment has been severely limited by mental health stigma and high treatment dropout rate. Military mental health leadership has now called for a mandate to better match therapies to patient preference. In 2011, Rick Yonk created the Warrior Canine Connection program to support treatment of service members with traumatic combat injuries at Walter Reed National Military Medical Center. WCC's mission-based trauma recovery program offers those in treatment the chance to be part of a meaningful and challenging mission of training a young service dog for a fellow veteran in need. The WCC program takes therapeutic advantage of the fact that even the most treatment-resistant veteran can still form bonds with a dog. I just want to stop here and say, combat trauma is a social injury. It attacks the social brain networks and really can only be addressed through social responses and treatment. WCC's Labrador and Golden Retrievers are specially bred for their calm, sociable temperament that will make them reliable service dogs. Training these young dogs provides warriors with a chance to practice and master positive, emotional, behavioral, and social skills essential to their trauma recovery, experiential learning. Besides the programs at Walter Reed, the mission-based trauma model has now been integrated into trauma care programs across the country, including Palo Alto and Nashville, North Carolina VA hospitals, and at the Marcus Institute for Brain Health in Denver. WCC has also become a popular and valued partner in the Veteran Treatment Corps programs in Maryland, North Carolina, California, and Colorado. In these programs, veterans in treatment can help fulfill their legal obligations to the court and to society by participating in WCC's meaningful mission of training a service dog for another veteran. WCC has been able to provide veterans and their families with over 15,000 hours of MBTR, mission-based trauma recovery, and 60 great dogs are now serving veterans with disabilities, providing facility support, or helping military families grow strong once again. So now, I'm going to put my other research hat on and describe the recent findings of two federally funded studies of the Warrior Canine Connection program conducted at Walter Reed. Anecdotal testimonies, as you all know, of our work and specifically of our work for the MBTR programs, popularity and the effects on PTSD symptoms reduction received support from a 5-year retro review of patient records at Walter Reed from 2012 to 2017. I put this slide in because I think it's very important to look at the incredible complexity of the things that people are suffering from when they have PTSD. This is a complex medical problem, and it explains why it has been so difficult to find mental health support in this country is not great to begin with. But when you have this smorgasbord of problems, it's very difficult to treat through standard programs that are on offer. It also explains why it is difficult for us to offer our program, because we're feeding it in between patients that are getting intensive, complex care, sometimes surgeries. So we just have to be there for them. We'd love to even be able to provide more hours, but we're there when they can be with us, and they come anyway. Also, you'll see that 585 participant notes were taken in the Alto records at Walter Reed, showing that people had volunteered for the MBTR program. There were many more, but the caseworkers and clinicians are very swamped and often don't make those notes in the Alto record, but we still got a nice snapshot here. Analysis of the actual MBTR session evaluations, we had 66 of them in the record, and they did show that WCC program improved cognitive, emotional, and social competencies. So that was a nice thing to see. In 2014, the Uniformed Services University in Bethesda, which is on the same campus as Walter Reed, was awarded funding from the federal government to conduct a randomized controlled trial of the efficacy of the Warrior Canine Connection program on the reduction of PTSD symptoms. We always have to start everything with the disclaimer from, from the government. So there you have it. I've done my duty there. These are our research partners at the Uniformed Services University for this particular study on human-dog interactions, neuroendocrine physiological alterations in service members with PTSD who train service dogs. Over 3 years, 29 volunteers completed the pilot study. 32 received treatment as usual, 12 received treatment as usual, plus 6 one-hour sessions of MBTR. 17 were randomly assigned to a waitlist group, receiving treatment as usual only. As you'll see, the PTSD psychological measures were taken pre and post the 6-week participation. So it was 6 one-hours of one-on-one training. And of all of the psychometric measures, all showed small reduction, with the exception of perceived stress and social support, which were significantly improved after the 6 hours of training. In contrast, the waitlist group, which was treatment as only, showed no improvement and, in fact, a slight increase in their symptoms at the end of 3 weeks of their participation in their treatment programs. This is perceived stress. You'll see that perceived stress did come down significantly. We were very happy to see that, because perceived stress sort of is the background that was mentioned earlier, that sort of lays the groundwork for a host of other improvements in the psychological and emotional well-being of the patients. This was showing the pain. We took pre and post pain per session, and was found that there was significant reduction in perceived pain after people participated in 1 hour of the training, which is very interesting, because sometimes the training, as you know, can be physically rigorous. And if people have pain, you might expect it to go up. In this case, quite the opposite, it went down. We conducted, very importantly, a qualitative interview, clinically conducted qualitative interview at the end of the 6 hours of training in 9 of the MBTR participants. And besides the fact that we got these wonderful results, about 100% satisfaction in the dogs, in the trainer, 100% reported that they felt improvement in their social and emotional competence and self-esteem. And 8 out of 9 suggested that the program be made more available and increase the length and frequency of session. That's pretty interesting when you consider that one of the big stumbling blocks of treatment as usual is a treatment resistance and dropout rate. I think you find it a striking contrast that our people wanted more. That's all they were asking for. It was their only complaint. Can we get more? We also did look at another objective measure called heart rate variability, which is the heart's ability to duck and dive and respond to stress. And we found that when they wore an active graph band on their chest during 2 sessions of our service dog training program, their heart rate variability increased at the end of each training session. Now that's important because increased heart rate variability is an autonomic measure of well-being in response to stress. And we know that heart rate variability is dysregulated in PTSD. So that was a really nice objective physiologic measure of effect. And those are the kinds of things we're going to hear a little more about, and they're very important that we not only have self-report, qualitative interviews, but we're starting to get some hard clinical objective measures that also show a picture of, yeah, this is working. There is one other thing I'd like to say about the qualitative interviews. They gave a deeper dive. They all agreed, the trends in the responses all agreed with the questionnaires that we had asked, the classic PTSD, depression, mood questionnaires that were asked at the beginning and at the end of the study. Comments all agreed with those trends, but they dove deeper into it. And they provided context as well, just showing how important it is to use both kinds of methods when you're trying to do this kind of research and show effect. 2 of the most important things were how the dogs, and you'll hear again and again, and you know this yourself, how they overcome the propensity for social isolation and retreat, which is another cornerstone to beginning to get better. So the dogs acted as social lubricants. People were amazed, actually. And they also took the lessons learned in the training home to their families and found that it improved their family life and communication and general well-being, which is another key thing, because without that social support, it is very difficult to get better, and it's very easy to get very worse very quickly. So I just wanted to read, I'm only going to read one comment because I thought it was so profound. This one person said, you know, there are times when I can't stand younger children. Those are some pretty strong words, because I don't really like it when they just run across me, because it almost frightens me or takes me by surprise, and I don't like being taken by surprise, especially when they run across you and stuff. So I guess on the civilian side, if I were to go out and go shopping at a mall and a child were to do that, it would highly aggravate me and put me in a panic attack. But this time, when I was with Derek the dog, even when children came up because they wanted to pet Derek, I didn't go into a panic, so I know that it does work. That's pretty powerful. Plus, that man has children, so we don't want him thinking that he can't stand them. Despite the 2 and 3 hours of research requirements that went along with the 6 1 hours of training for people who are overburdened with medical appointments and other requirements in that outpatient program. MBTR participation was very high. 11 out of 12 MBTR participants completed all 6 one-hour training sessions, and the only person that had to drop out, they did so because of an unanticipated health issue. As I said, 8 out of 9 of the participants who completed the qualitative interview thought the program could be improved by increasing availability, length, and frequency of sessions. We do always have to say, as you will hear, that the data set in this pilot is small, so general conclusions are limited. However, the impact finding of this study is that it supports the feasibility and acceptability of service dog training model as a complementary adjunctive treatment modality. That is the punchline we've all been waiting for. Now, I'd like to turn this over to, I just want to say that we're going to be doing, and currently are in the middle of a longer research program, we're going to double the length of MBTR sessions to 12. We're going to be following people for up to 3 months afterwards. We're going to do a deeper dive into the genetic and biological and physiological effects of the program. And we are very pleased that and hoping that this will give the added support to these pilot studies, these studies that you're going to hear today, that we're well on the way to establishing this as a clinically accepted adjunct therapy for service members with PTSD, and one that we'll be able to bill insurance companies for. So I would just like to thank our investigators at Uniformed Services University that helped do this work that is, as you have heard, tricky. And this is the title of the long-term study that we are now involved in. And just to give you an idea, there'll be 220 people involved in that one. Now I would like to introduce Brett Simon, the president of Canine for Warriors in Ponte Verde. Wait, I might have this wrong. Hang on just a second. Wrong, I am wrong. My pages are out of line here, sorry. I'm going to introduce Ryan Woodruff. Ryan is the director of canine programming at ClearPath for veterans in Chittenango, New York. And he will be telling us about, we're going to go from our study, which looked at the smallest dosage, 6 one-hours of training of service dogs, to the longest dosage, the biggest dosage, which is their program, which is 12 months of training, 12 months long training. Ours is training for another veteran, and this is it's an owner-trainer model, so they're quite different, and I think you'll find the contrasts fascinating. So, Ryan, if you would tell us about your program.
I can, if I can figure out how to work this mic. Okay, we're good. So, the Canine program at ClearPath for Veterans, formerly known as Dogs to Vets, primarily serves veterans and/or active service members pending separation, diagnosed with post-traumatic stress, traumatic brain injury, and/or military sexual trauma. Due to the extended nature of our program, we have radius requirements of 75 miles, and that's for the fact alone that we do have an extended training timeline and we require veterans to be at our facility at least once a week during that time. Each applicant considering enrollment entering into the Canine program, again, must have a service-connected diagnosis for PTS, TBI, or MST. This is verified through the Regional Veterans Administrative Office, and those that are selected will undergo the following screening. Each veteran will submit a brief letter of interest along with their DD-214 paperwork from their VA regional office. At that point in time, we will send them an online application that's generally a little bit more thorough. At that point, after that following review, we will schedule a consultation with our behavioral health consultant, and that was integrated as a result of the symposium in 2017. So over the course of the last 3 years, we hired a part-time behavioral health consultant, which helps us identify needs and readiness and also facilitate more research. At that point in time, we schedule a one-on-one interview with a program manager, and at that point we do a consultation with the dog. We submit a registration packet to that individual and ask them to get it back to us within a reasonable time frame, and collectively we'll make a decision on that individual's enrollment. The Canine program at ClearPath offers a unique model in that it incorporates owned dogs, shelter dogs, breeder-selected dogs, and purpose-bred dogs. Those included within the puppy development program are from vetted breeders that include groups that are both purpose-bred and non-purpose-bred. Regarding breed selection, any dog may be considered so long as they are able to facilitate social interaction and are generally accepted in broader communities. During the course of the study completed in 2018, dogs were both from shelters and previously owned. Over the course of the study, the Dogs to Vets program was primarily based on an owner-trainer model. Dogs obtained from shelters would undergo a period of 30 to 90 days of fostering and professional training prior to placement. During the recently completed study, dogs would receive private training for a period of up to a year. Dogs obtained from shelters would undergo a foster period with professional training from 60 to 90 days prior to placement. Each enrolled veteran would undergo a 6-week introductory program designed to assess both the veteran and the dog for criteria that would deem them an appropriate candidate for one-on-one private training. Primarily, the criteria were based on the veteran's cognitive ability to grasp training concepts and to incorporate them into their daily routines so that trainers could notate and observe progression during the introductory program. This was conducted in a group class with up to 5 veteran dogs teams. Once selected, the veteran would be matched with a professional trainer on the ClearPath staff to undergo private training for up to 12 months. Benchmarks during this period would include the AKC's Canine Good Citizen, Advanced Canine Good Citizen, and a public access test. We do have a residential program, but that is only offered to 1 veteran per training cycle just due to the logistical nature of what we have currently available to us that would be fit for a veteran not within the 75-mile radius. Each session was between 60 and 90 minutes and would be weekly. I was asked to also notate that ClearPath offers several other programs and services to include peer support, wellness and social engagement, culinary, and warriors working for employment. So that's all I have regarding our program. I look forward to answering any questions you might have, and look forward to meeting you, and thank you for the opportunity.
Thank you, Ryan. Hello, and I'm the other half of the team here, Dessa, Bergen-Cico, and I'd like to shout out a special hello to all the doggos and puppers here, as well as the people. So from the statistical aspect of things, I'm going to give an overview of the research design and the study that we conducted here. And my background and work comes from the area of substance use and addictions and traumatic stress. And I've always been very interested in trying to find non-clinical ways to effectively help to treat individuals, because so few people, not only in the US, but around the world, receive formal training and treatment. And we know that there's a lot of ways that we can help to support people in their recovery. So we had 48 participants that completed data collection for the study, and they were either enrolled in the owner-trainer dog program at ClearPath, or they were on the wait list at ClearPath. And as Ryan had mentioned briefly, participants were also engaged in other social programs and programs and opportunities. So some were social, some were what's called the wingman program, where you sort of have a mentor, and there was no statistically significant difference in terms of people in the waitlist control group and the veterans in the Dogs to Vets program regarding that. We followed them for a period of about 12 months, looking at pre and post measurement and assessment. The key measures, Meg kind of gave an overview to this before, but looking at the PCL or PTSD symptoms, perceived stress, self-compassion, and then in self-compassion scale, there's some subscales for isolation and self-judgment. and then also looking at qualitative feedback from folks. Oops, wait, I think I've gone back too far. I'm looking at my screen here on the computer. All right, there we go. See if I can get it there. So I don't know how well you can see, but down in the corner there's a picture of a person with their mind full of all kinds of random thoughts. And then there's their dog that has a picture of them and the human walking. And so it kind of is a nice contrast in terms of looking at, is your mind full or are you mindfully present? And dogs tend to be in the present moment unless distracted by a squirrel. And so my research that I'd been doing with veterans through our local VA was looking at mindfulness-based training and practices to help for PTSD symptom improvement. And we found significant improvements in that. But it's also anybody who's tried meditation, and even myself as a certified mindfulness instructor, it's difficult. And so I wanted to try to find ways to achieve those same types of benefits through other mechanisms, and found that what I was observing and studying with owner-trainer model with dogs was some similar changes. So the key kind of analogy here is that we're looking at repeated practice, neural rewiring and firing for both the human as well as the dog, and that you're constantly being brought back into the present moment by the dog and their behavior, and then also by in the training process through the instruction and the other aspects of that. And so there's really an interesting analogy here for what we know has improving or increasing scientific rigor behind it, and finding other ways to get that same strategy. So those are kind of the theory behind this. And what we found with the results, and again, Meg touched on this, so I don't need to read them to you per se, but that there were significant improvements for the people in the Dogs to Vets program, and there were not significant improvements in the people on the waitlist control group. Very interestingly, when we looked at the qualitative findings, those were also really insightful. And some of the commentary, I'll just read a few quotes here to you before getting into the graphs, really spoke to the importance for the veterans to be involved in the training of their dog rather than just receiving a service dog, even though there can be benefits certainly to both. One of the quotes here from a participant says, "To see my dog grow and learn has been important. One of the greatest satisfactions I had while in the military was teaching and training soldiers. I get some of that same feeling as I've gone through the training with my dog. Within that context, our relationship has grown and developed, which I didn't think was possible for me to have with an animal." And so I think that's a nice way to kind of summarize. There's endless beautiful commentary about the importance of the dog in their life, and some of the other aspects are, very concrete and practical, such as it's forced me to be more social. I must ensure my dog gets to the park and to other places that I'm not very comfortable going. Other key elements in terms of feedback speak a little bit more too to some of the other folks who are here that are looking more at training dogs to be able to pick up on medical conditions, respond to some of those things. And so here's a quote from someone who says, my Lily picks up on my distress before I do. We had a party and my nerves hit. She came and sat next to me, nudging me until I rubbed her at least once, and then she was able to go and visit others. And so it's on this multiple different levels that we see these benefits. So let's look here at what is some of the charts and graphs show, and a very simplistic piece here. So the dotted lines represent the waitlist control participants, and again, their treatment as usual, active in other areas. The solid line represents the veterans in the Dogs to Vets program, and this is looking at changes over the course of a year in their PTSD scores. So it signifies significant reduction in their symptoms. This is looking at longitudinal changes in perceived stress. And again, the dotted line represents the waitlist control, and the solid line is the dogs to vets group. And so we see that for the waitlist control, their perceived stress continued to rise somewhat. And for the folks in the dogs to vets program, it dropped significantly. And it's helpful to see that these two measures, the PCL score and perceived stress, have been measured across, I think, virtually all of the studies up here. This is looking at changes in self-compassion. And so self-compassion is different than sometimes we think of what's considered sort of hollow self-esteem. And self-compassion is actually interesting new emerging research looks at that low levels of self-compassion are predictors of PTSD. And so when you're looking at those issues. And Kristen Neff developed this scale, and it's been translated into multiple languages and used across many different studies, but it's also something that I've used in the research that I did around with mindfulness and looking at it for anxiety, depression, and addiction potential. And so to see significant improvements in self-compassion, this is the ability to be kind to yourself in the face of difficult experiences. This is looking at changes. This is probably one of the more dramatic graphs, and this is looking at self-judgment. And so if you look at the narratives of a lot of veterans who struggle with PTSD, there's self-judgment about past experiences, and then there's self-judgment often about the challenges they have with their ability to sometimes integrate back into society and to manage their symptomology. And so this, to me, was just a beautiful finding that we saw such significant decreases in the levels of self-judgment for individuals. And again, when we look at the qualitative findings, a lot of this was reflected in the statements, such as that the dog was accepting of them no matter what. And since they were accepting of their dog no matter what the dog did, it was a nice way for them to kind of mirror, understand, and give themselves some more compassion around some of these things. And this is a similarly dramatic graph, and this is looking again at a subscale of that larger self-compassion scale and looking at isolation. And so we saw significant reductions in isolation among the individuals. And the measures in this construct, which you can look up, is not just self-report about did I go out more often and those types of things, but it's really looking at internal reflections and your sense of connection to other individuals and connection to society as a whole and connection in terms of having some sense of purpose. I began by speaking a little bit again about the aspects of where did I think that these theories came from around looking at mindfulness-based skills and how those might be able to be developed through interacting with dogs. And again, one of the key things we know that from the mindfulness-based practices have helped to significantly reduce PTSD symptoms, but it's also a difficult practice. And I think it's often a luxury for people to be able to engage in what's considered the evidence-based curriculum around those things, and it's not necessarily accessible to everyone. So what sort of the mindfulness-based practices help to do is not only reworking and rewiring neural networks, but helping to calm the area of the brain called the amygdala that is hypervigilant and very responsive, and that this can help in terms of these practices help to strengthen the prefrontal cortex and sort of bringing you back into the present moment and to give you even a millisecond to respond rather than to react to a situation. And we see those same types of changes occurring here with the interaction with dogs. The other thing too is that anyone who interacts with dogs knows that dogs, with the exception of the very few calm dogs sitting in here on the floor at this moment, usually require attention quite periodically, and so they have the beautiful attribute of disrupting and disengaging people from ruminating thoughts and being able to fixate on things for too long. And I think that's a beautiful way that they can help us. The last piece here is to look at in terms of compassion and mindful awareness of the dog's behaviors and emotions that people have through, again, this dog trainer type of model is a means for people to understand their own internal experiences. And we saw that again reiterated in the narratives of the veterans that participate in this program. And so non-human animals are innately connected to nature, live in the present moment, embody many of the foundational qualities of mindfulness that we try to foster in other ways. And so these descriptors, which are considered to be what are sort of the attitudinal foundations that you try to cultivate through mindfulness-based practices, are very much what qualify when we think particularly around dogs. They're non-judgmental. Generally, they're patient. Right? They're trusting. They're non-striving, except maybe if they want a treat. They're accepting of us and of others. They tend to let go of past regrets. And they always have a beginner's mind. So whenever you come through the door, it's like, hey, it's that same guy. It's that same lady. And they're happy to see us. And that is all that I have to say.
Thank you, Dessa, and thank you, Ryan. Now we're going to see how fully integrating 21 days of intensive service dog handling instruction with an immersive, intensive psychological training program affects the symptoms of PTSD. So, Behe Shadone, will you please tell us about your fascinating program?
This Able Veteran was launched in January of 2011. Our program is based on developing service dogs for veterans living with psychological injuries, and now we're offering service dogs for physical injuries in some cases as well. Our program screening involves a veteran making an application. The family and the therapist also have a portion. The application is rather extensive, and what we're looking for is readiness for change. The treating medical provider also provides input, and then we follow up with an interview with not only the veteran, but the clinical provider, and often the families as well. Our program requirements include a PTSD diagnosis, and they have a minimum of 1 year in therapy. And they also agree to remain in therapy for the next 18 months post-program. They also allow us to speak with their clinician, and they must show that they're able to support the needs of the dog. They return every 2 years for a recertification program and a refresher training to help build the skills when they're in our program. We obtain purpose-bred dogs, and these pups are acquired at 8 weeks of age, and they stay with a trainer until they're 1 year to 18 months of age. During that time, the pups live with the trainers 24/7. The dogs are developed to a very high level. Part of this Able Veterans background is that we have pioneered the anxiety alert as well as nightmare interruption. And nightmare interruption can come in many forms depending on the signature of the nightmarer. These dogs are I'm going to skip over this just so we have plenty of time for Rich, but the dogs are trained fully before they're placed with the individual, the veteran that comes into the program, and when they come in from around the U.S., they come to our campus and they stay for 21 days. and it's 9 to 4 each day for 3 weeks. It's an intensive program. They not only learn to work with their dogs, but they also build crucial skill sets for dealing with the symptomology of their trauma and get to the heart of the issue and work on skill sets to find their way through it. Our goal is to help these veterans be able to not only cope, but heal the wounds that they have come in with. And that's so crucial in our program because our goal is that the veteran develops such a skill set that they are able to spend the time that they have with their dog to the degree that the dog can retire before he dies. The goal, I always say this, the one most powerful thing that service dogs do is that they buy time. And the time that is spent for those 8 or 9 years, or hopefully more, that this veteran has taken the time to immerse himself in what it takes to truly heal. And by the end of the dog's life or near, that veteran has such a skill set, such an ability to have resilience that they can deal with life on life's terms at the inevitable time when that dog dies. That they're able to go out and, with the skills they have, and rescue another dog and have a pet. The paradigm shift that this able veteran is focusing on is the difference between a physical tasking model and a model that helps veterans deal with psychological injuries, actually helps anyone deal with psychological injuries. There is such a difference between a dog that assists us physically and those that assist us in emotional healing. The two wings on the bird, as far as we see it, is the service dog is one wing on the bird. The trauma resilience aspect is the other wing on the bird. And that's where the individual learns how to cope with the injuries that they've received and actually use it as a transformative opportunity to become stronger and give it all back. Simply offering a dog as comfort is not as important as helping the veteran or the individual spend the time with that dog and truly learn healing. The social interaction that's emphasized in the trauma resilience program is that individual learn how to go out and reintegrate versus isolate. We run 2 trainers' academies to help educate other trainers and other organizations about the importance of how and why we do what we do as far as bridging having a dog and that dog help with symptomology versus a dog that actually can be useful in true healing. And when we heal truly here, we heal truly there. And that's what this able veteran is about. I think that's all I have. Yes, thank you.
I'm here to talk about the study that we did of the programs at Disabled Veteran.
This is Richard Hunter.
And I'm also going to talk about our research project a little bit, and I'm going to expand the findings from what we published in the article. The main difference, I think, between this program and some of the others that we've heard of is that Haitian invited me as a clinical psychologist to come in and develop a resiliency and life skills training program to combine that with the excellent training that she did for the dogs in the program. Let's see, I'm going to talk about a timeline first. On the 27th of February in 2013, Bahesha invited me to come join the program at Disabled Veteran. I hadn't previously known about the program, and so she kindly brought me in and showed me what she had done in training these dogs. And I was absolutely amazed. Bahesha Doan is a wonderfully skilled trainer of dogs. And she had those dogs doing things I didn't know a dog could do. And because of the short time, I'm not going to go into some of the examples, but I would be happy to talk privately afterwards with somebody if you want to know. And she invited me to come and join the next class as a psychologist that was going to be held in April of 2013. I thought that would be a pretty easy project for me because for almost 50 years I'd been involved in treating the most difficult cases in psychiatric hospitals, many of which were related to trauma and mental illness. Matter of fact, I was introduced to trauma very abruptly as a young clinician when I was assigned to a unit in a psychiatric hospital that had over 80 Holocaust survivors, many of whom couldn't speak English. They spoke Polish and Yiddish and German, and their lives had been destroyed. And it was a rude awakening for me about the involvement and interaction of trauma in both damaging our mind and our soul. And so for many years I worked and I did consulting all over the United States for the most difficult to treat clients in these psychiatric hospitals. And I thought this program at TAV would be pretty easy because these were outpatients. These were people who were functional. They could live in their own home and they could to have jobs and do these other things. And I thought that's going to be a pretty easy assignment for me. Happy to join her. Well, that first class in April of 2013 had some of the most impaired veterans with post-traumatic stress disorder that I'd seen in a while. Many of them were Vietnam vets who for 40 years had been treated in the VA unsuccessfully and came in at very high levels of PCL scores, were highly suicidal, and I thought, my gosh, I can't believe these people are outpaced. They would come in with a bushel basket load of medicines, most of which did no good at all and some did harm. And it was a difficult group of people to deal with and to treat. I was absolutely amazed at our outcomes. We developed what we called a human resilience and life skills training program. That's a whole lot better than calling a program psychological training or skills, because a lot of these vets had had all that they wanted from the VA, and they didn't want to deal with that. So we did this more of a psychoeducational involvement and therapeutic community kind of a design. But when I saw how those people interacted after those dogs were introduced, it was absolutely amazing to me. Because like I said, I'd been involved about 50 years in treating cases, and I had never seen that much progress that quickly. What we saw in 21 days of service was absolutely amazing, and it was beyond what I could believe. And the dogs and the support dogs that Bahesha and her team had trained were marvelous. They helped build a crack in that wall around the heart and the emotions of these people. And we were able to drive in a wedge into that crack and widen it and open it up so we could get in there. And it was those dogs that were very, very important in that process. And as a result of that, I told Bahesha that we have got to get some research on these outcomes, that I couldn't believe it. Like I said, these were treatment refractory people. These were people that had been in treatment for many years. And matter of fact, after one of these people graduated, he came up to me right after the class and he was giving me a hug, and he grabbed my shoulders and he just started shaking. And he said, "Doc, why didn't I get this 40 years ago?" And he was crying and he was angry. And he said, "If I'd have gotten this 40 years ago, I wouldn't have lost my marriage. I wouldn't have lost my relationship with my children. I wouldn't have gone to jail as a drug dealer. My life has been ruined by PTSD. Why didn't I get this 40 years ago?" And I said to Behesha, I said, "We have got to study this, and we've got to get people to come in and measure these outcomes." Well, we didn't have any money. We didn't. Our research wasn't funded by anybody. We were hand to mouth almost, weren't we, Behesha, with just getting textbooks and other things that we needed to get the project going. So I went up to Southern Illinois University Department of Psychology. I've had a relationship with several of the people up there for several years. And I explained this to one of the professors there who I had known. And I said, "You've got to get us a doctoral student down here who is trained in trauma. And we'll set this up for her. We'll design the project for her, or him, whoever it would be. And all they got to do is come down here, and we've got their dissertation already set up, research already set up for them." And so she recruited Megan Clope, and she accepted the invitation to do our study. And so that's how we got 2 different classes studied. The second class, I can't see that slide very well over there, but the second class that we had, the second class that I was involved with was in October of 2013, and that was the first class in our study that you will be seeing the results for. And then in June of 2014, we had the second class in the study. In August of 15, I resigned from TAV. I was a volunteer there, but I was getting up in age and having some health difficulties. And my wife was demanding that I retire and start traveling with her. So what I'm going to be talking about today is just my 2.5 years there at TAV. But we got the study underway, and it was finally published in 2017 in the American Journal of Orthopsychiatry. And I think ADI or Meg or somebody might have that available to you through the internet maybe or something, I don't know. What I'm going to talk about, though, is I'm going to give you a little bit different data set. This is the same data that came from the study of our 2 classes. But it's because of the journal had page limitations and they wouldn't let us do very many figures, we didn't really present the data that we had. We didn't present all of our data. So I'm going to show you more data today. The other thing that happened was that the peer reviewers in for the journal, they wanted us to combine both classes because our N size was small. And they thought that it would be stronger for them to present this as just one study or one class. What we lost with that was replication. You know, you could do a study and get outstanding results, and then you say, "Oh, well, that's just unique. That happened one time." What we tried to do is get them to let us present both classes as separate events, which they were, to show that we have replicated this results with 2 separate classes. They wouldn't allow that. So what I'm going to do today is show you the data that is for both classes separately. So let's start with our first measure. You'll see there along the bottom, there are 7 data points. The first data point is 30 days before clients came into the program. This first measure of the PCL, that's a standard measure used in the military to diagnose post-traumatic stress disorder. Their cutoff for a diagnosis is a score of 50. So the first time point is 30 days before entering the TAV program. The second time point, number 2, is the day they arrived at TAV. The third is the end of week 1. The fourth is the end of week 2. The fifth is the last day at TAV. That's when they left. Time 6 is 30 days following discharge from TAV. And time 7 is 6 months after they graduated from TAV. We wanted to see if the skills and the psychological treatment interventions that we offered at TAV in conjunction with the support dogs would last over time, and that was our 6-month interval. I'd like you to notice something too about that. The PCL scores, you can see that all of our clients, or the average of all of our clients, came in well above the diagnostic level of 50 on both classes. And at 6 months, they were well below diagnostic levels, around 32. Matter of fact, we had a drop in PCL scores in 3 weeks of 30 points. That's never been done. It's never been published before. Never been done to my knowledge before. So one message you can take from this is that if you combine competent psychological services with competent support dogs, you can take treatment refractory people with post-traumatic stress disorder that come in at a very high level and within 3 weeks drop them to non-diagnostic levels to a 30, and it'll remain for 6 months. That's a very powerful finding of this study. I want you to notice something too about that. You'll notice that during week 1, 2, and 3, you'll see a progressive drop, that people get better each week. But notice the second class at interval number 6. Do you see where that chart goes back up where they got worse 30 days after they left the program? That's going to happen on every one of our measures, and I want to explain to you what that is. Class 2 had several vets who were in Iraq, and many of them were in the city of Fallujah. During that interval, after they left our class, there was a decision made by the commander-in-chief to remove our soldiers from Iraq and Fallujah specifically. And many of those soldiers felt betrayed because while they fought intensively for Fallujah, they lost friends, they saw their friends maimed and killed, and they felt that they had been betrayed because they had lost all they'd seen, all their suffering was for naught. One of our vets was a military chaplain, and his time in Fallujah, he spent organizing what we would call a school for the children of Fallujah, and he would provide them toys and books and tablets and pencils and colors, had his wife send over toys that his own children had his wife organize others in the community to send toys to give to these children in Fallujah in this program. When he learned of what happened to those children, he lost it. Because when ISIS came into Fallujah, they rounded up every one of those children that was in his class for 2 years, whom he loved. ISIS slaughtered those children. And he called me one afternoon and said, "Doc, I've got to come back and see you. I've got to come back." He drove many hours to see me, and we spent all afternoon together, and then he turned around and drove many hours back. That was what caused that regression, But if you notice something, the skills that we had taught him and his classmates to deal with unconscionable things that would happen to them, they used those skills to recover, and by 6 months, they were right back to where the improvement was noted again. And you're going to see that as we go through this. This is a PCL. This is a diagnostic scale they use to diagnose post-traumatic stress disorder. Here's depression, another very common co-occurring condition with post-traumatic stress disorder. Notice the tremendous results we got in both classes in the levels of depression, but you'll see that 30-day out regression again. But there again, they used their skills and training to reduce their symptom level. This is an anger measure. Tremendous improvement in anger and their ability to control anger. Their ability to self-perceive and self-monitor is when they're starting to build up anger. They learned, we taught them how to reduce their own anger and to change their thoughts. This is anxiety, which is another common co-occurring diagnostic problem with post-traumatic stress disorder. Same thing, but you notice the 30-day after, that was the betrayal. This is a quality of life measure, which shows tremendous improvement with both classes. And you can see that we replicated those same findings in 2 classes. In my mind, we replicated it with 3 classes. That's the power, again, I think, that this, even though our sample size was small, I think that shows you the power of this particular program. So what was the program? What did we do? Well, we operated in a group format similar to a therapeutic community program. We were with them 21 days in a row. Bahesha would not let them go home or spend the weekend off. We were with them 7 hours a day, 21 days in a row. We used a psychoeducational approach involving active participatory learning, and it was designed along with other therapeutic interventions. Bahesha and I integrated the lessons that we were teaching. One of the examples was she would use her dog, Yachty, and get that dog to become very aroused and aggressive. Matter of fact, she would have him attack one of her staff members who had a padded suit on. What? She said he wasn't a service dog. He was a mean German Malinois, I'll tell you that. I wouldn't mess with him. But he would become very aggressive, and he would, at her command, would charge this person and jump up and grab their arm and just show all kinds of what we would in psychology call sympathetic nervous system arousal. Over-arousal is what I should say. And then Bahesha would whisper a command to Yachty, and he would immediately settle and be quiet. And at the same time, I would be teaching them how to self-monitor their sympathetic arousal, their anger, their pain, any kind of pain they would be having that would increase their anger or whatever, panic. And would teach them skills to self-monitor and then self-regulate. And it was interesting because if they saw this dog immediately take control of it, they couldn't deny that they couldn't do it. As a matter of fact, they were very smart human beings. They had a lot of cognitive abilities the dog didn't have. So if that dog could do it, surely I can do it. And so we would use those kinds of symbiotic lessons throughout the 21 days to teach various things. She would be teaching one thing with the dog and how the dog would think. And we talked a lot about mindfulness too, and being in the present moment. And the dogs have one time, it is now. And so we would integrate a lot of these various lessons together, and I think it may help the program be more successful. What? 1 minute. Okay, well, the other thing we did was we introduced an autogenic training protocol that I developed many years ago. It was a kind of protocol that helps us regulate sympathetic arousal and be more mindful and so on. And I think that was an important protocol. We tried to take the vets through that about 30 minutes every day.
I was saying that's nice.
Yeah. And we'll make that available to you too, by the way, some way, if maybe ADI or you or somebody would be happy to share that with you. It's a little recording. You can put it on your phone and you listen to it and you go through this little kind of self-directed protocol. One other point I'd like to make about the service dogs at TAV. They were trained to socialize vets. They were trained to understand when vets were nervous and were upset, and then we would teach them the psychological skills to dysregulate any of the issues that they were having. I was very upset to learn a few years ago when the VA was funding a research project that they were teaching their dogs, they were using dogs that were taught to block social interactions. They were teaching dogs to scan a room before a vet would enter, turn a light on to make it more safe for a vet to enter. We don't think those are appropriate things to be teaching if you want to be consistent with state-of-the-art treatment for post-traumatic stress disorders. Those kinds of activities reinforce the vet's exaggerated fears that their house or their building or whatever is a dangerous place. One of the messages I'd like to leave is that I would hope that ADI and others would develop standards for training psychiatric service dogs so that the activities and skills that the dogs learn will be consistent with state-of-the-art treatment practices. Thank you.
Well, thank you, Richard, and thank you, Bahesha. That was really interesting. Now we're going to turn to Canine for Warriors. Canine for Warriors was a service dog program in the spotlight last year with the publication of their Purdue study, which we're going to hear about now. Brett Simon, will you tell us about your 3-week intensive dog handling program for veterans being partnered with service dogs? So again, another 3-week intensive program like we saw with the last one, but differences. So take it away, Brett.
Thank you. Canines for Warriors was opened a little over 8 years ago, and we accept veterans veterans and active duty. Our active duty members do have to provide a letter from their command to say it is okay for the service animal to be in the job or the role they're at. Our program is a 21-day live-in facility. We accept clients nationwide. The application process is done through online. Once we've received an application and we have gotten the proper documentation for it, we start giving the phone calls. So they're required to turn in their DD-214, a letter from their mental health professional, and their primary care physician to say they can physically make the 21-day program, along with the diagnosis of PTSD, traumatic brain injury, military sexual trauma from their mental health provider. As they run through the process, we have a staff that stays in contact with them constantly, and 180 days out from the program, we are in calls with them at least once every 2 weeks, if not more, to make sure that they are ready for the program and that they're going to be able to be there. A lot of life circumstances happen, and if they do have to drop out because of a family emergency or something like that, we do get them rescheduled into the program. As we go through that application, we learn about their lifestyles and also their jobs. If they are employed or at school, we require also a letter from their employer to say that the service animal will be welcomed into the job or the role. And if we find they have a job that is not conducive for a service animal, we work with them to get them other resources, maybe even move to another division in their company so that they still can receive a service dog. If not, we put them to a resource that can help them to mitigate what's going on with them and try later on to bring them back. During the 21-day program, our veterans work with veterans that have graduated our program. They've gone through the 21 days and they've grown in their personal journey to be able to come back and give back to the veterans that are there. So we have that camaraderie of a veteran 1-to-4 student ratio of them working with the veteran. They do that Monday through Saturday. Unlike Bahesha, we give off Sunday. But we do bring in veterans of all eras for a grill out on Sunday to get the social interaction with their dogs for strangers that they haven't met, and allows them to open up a little bit, and we watch them grow in that process there. While they're, while they're there, they have the opportunity to talk to a mental health professional that is part-time on staff if they need to. That lady also goes over our applications and helps us to figure out what is going on and the best path forward with a lot of our veterans that come through. Also during that, we give them lecture time 2 days a week, 2 hours each, on all care of the dog, federal and state laws, training theory, anything that we can get to them in the 21 days. It is a fast-paced environment, and we know they're not going to become dog trainers in 21 days, but at least they can understand some theory and behavior and learn luring, molding, shaping. Our dogs are mostly shelter and rescue dogs, 90% of them, and owner surrenders. They go through several temperament tests, 1 at the shelter and 2 more at our facility before they go into training, and they are pre-trained before the veterans get there. Excuse me. So that once they are there and we do the placement, really we're just teaching the veteran and teaching them how to do the dog or work with the dog one-on-one. Once they get through the first week of that, then they are on their own to do some extra training in the evenings, but we do give them some supervised homework through a person living on campus with us there. When the 21-day program is over, we do the practical test, similar to the AKC and the public access test, and their graduation is on that 21st day. We send them home. Our follow-up process is within 1 week. We're calling them to make sure everything is okay. Within 10 days, they need to provide us with a veterinarian letter that says that he is treating this animal. The reason we do that, if you guys haven't had it happen, a veterinarian is called a HIPAA law on us before and will not talk to me about one of our dogs until the handler said it was okay. So we're just getting in front of the cart there. And then we stay in contact with them. Our follow-up is at 6 months, 1 year recertification, and then every 2 years after that. We've also developed 2 social media outlets for our veterans. There's a closed group for them, and that's how we monitor a lot of stuff going on too. They will post in there, and the rest of the team can see it, and the rest of the veterans can help them out too. It's a safe place for them to do it, and it is actually a really critical tool for us to see somebody in distress that's not reaching out yet, and they may just make a little post, and we have a team that gets activated after that. And we follow up for the life of the dog with the veteran and help them out, support them any way we possibly can, all the way up until the dog either is replaced or retired, and then we have a plan going forward from that. And that's a little bit about Canines for Warriors. Thank you.
Thank you, Brett. My name is Kerri Rodriquez. I am from the Center for the Human-Animal Bond at Purdue University, which is just an hour north of here, so we were super excited that this conference is in our backyard. I'm going to talk today about our research with Canines for Warriors. First of all, I wanted to point out our funders for all of our research, which is the reason why we are able to do this research. They're in the bottom left, and so huge shout out to them for supporting our almost 5 years of research with Canines for Warriors at this point. So our overarching research goal, kind of our long-term goal for this collaboration, was to quantify both the efficacy and role of psychiatric service dogs for this population. And when we started this back in 2015, this was a huge collaborative research effort that took a lot of collaboration from different people and centers, obviously ourselves at the Center for the Human-Animal Bond, as well as Canine for Warriors kind of spearheading. But we also have had success in our research from consultations and collaborations with other organizations, such as the Military Family Research Institute, which is a huge center also at Purdue University, a couple other of universities, including Minnesota and Arizona, and with help of clinical psychologists from our local Indianapolis VA. So I'm up here, but just to give you context that we have a big team behind this. So I'm going to talk about kind of 3 phases of research that we've done with Canines for Warriors. The first is what we think of as our pilot study, kind of our first stab at this. The second, when we really tried to define the role and the intervention itself. And then our current clinical trial, which we are in the second year of. Brett gave a great overview of Canines for Warriors, but one thing that we find really cool and we wanted to point out is that they are, as Brett mentioned, mostly shelter dogs and owner surrenders, so not purpose-bred dogs here. So these are just examples of some of their pups. So our first study, as I said, kind of our first stab at this, we took what we call a cross-sectional design, which is where we just compare two groups. So one group has a service dog at home already. You could have had your service dog for 3 months or 3 years. And one group is on the wait list. The numbers got a little weird down there, but essentially we had 75 with the service dog and 66 on the wait list. And we just basically compared them on many different measures. We had 23 different measures from everything from PTSD, of course, to sleep, social health, relationship health, quality of life, et cetera. And from that study, we have published, also, I forgot that we have included spouses in this research as well. So we really find it important to take a family-wide approach to our research. And by including spouses or significant others in our research, we hope to look at kind of the direct and indirect effects that a service dog may have on spouses. Indirect being that the dog is helping the veteran's PTSD, and that is translating hopefully to improved relationship quality and family functioning, and direct in that we hope that the service dog coming in the home is able to relieve some of the caregiving burden and stress that that spouse has. So the way that we approached this first study is that we did an online questionnaire with veterans. That was about a 30-minute questionnaire of all of our measures. Spouses also did this questionnaire. Then we were able to do a record review with Canines for Warriors, which allowed us to look at PTSD symptoms longitudinally over time. And then we also collected saliva samples from veterans. And we chose to incorporate a physiological measure because we wanted to see if this is something that we should pursue in larger research. And cortisol is our stress hormone. We've talked a little bit about it today. And we used to only get cortisol from urine and blood, and now we can really reliably get it from saliva. So we asked veterans to spit in a tube and ship it to us at Purdue to look at how the dog is influencing their stress levels. So we have published 2 papers from this pilot research. The first one was our preliminary efficacy on PTSD symptoms, where we found that having a Canines for Warriors service dog was related to clinically significant reductions in PTSD. We also found that the groups significantly differed in secondary measures, such that veterans with the service dog had lower anxiety, lower depression, better quality of life. They said that they slept better, they had better family functioning, et cetera, et cetera. So a lot of positive results came out of that pilot study, but again, it was cross-sectional, so we weren't really sure how things change over time. We didn't measure veterans before they got a service dog or after. We just compared the 2 groups. The second paper that we published was looking at the veterans' cortisol levels, and we, again, did find significant differences among the groups. Specifically, we found that veterans with the service dog had healthier cortisol profiles, closer to what we would expect from healthy adults without PTSD. So that was kind of our first stab at that. I'll be talking about how we're measuring that more intensely in the clinical trial. We also are publishing 2 more papers from this to come out hopefully sometime soon. The third one found differences in medication use, specifically that veterans of the service dog report less reliance on their anxiety medications, including less use of SSRIs. And then our 4th paper will look just at spouse and partner functioning, which is in collaboration with the Military Family Research Institute at Purdue. So stay tuned for that. So our second study we did right after this first study, and this one was really to define the intervention The numbers got a little weird up there as well, but we had 134 this time with the service dog and 82 on the wait list. So another cross-sectional study. And really our goal for this was to look at how often veterans are using their trained task on a daily basis, how the use of the dog relates to their PTSD, the bond, and time, which PTSD symptoms are specifically helped the most and the least by the dog, and importantly, how waitlist expectations are differing from the actual experiences. So this was kind of our defining the intervention study, where we really looked at the nitty-gritties of what happens once they leave Canine for Warriors. And that has been kind of our focus for that. And of course, looking at the dog, which a lot of this population ask about, which is how does the dog's temperament affect things? These are shelter dogs with incredibly different personalities and behaviors. Where does that play into outcomes? So we have already published that dog outcomes paper, which was in collaboration with the veterinary behaviorist at Purdue University, and we will be publishing the veteran outcomes very soon. But spoiler alert, we have found some really interesting results from that study, mainly that veterans are using their dogs an average of 3.2 times a day, putting numbers behind it, and that task use does tend to decrease over time, so that they become less reliant on their dogs over time. And this study has also really highlighted the importance of the human-animal bond, which we all kind of know is really important, but it really quantified and put numbers behind that. So we found that the stronger the bond, the more often that veterans use their dogs on a daily basis. So they were using tasks more often, and it's really interesting because we can't determine causality. So we don't know if the bond starts to develop and then they use their dog more and more, or if they're using the dog more and more and the bond develops. So we're hoping that our longitudinal research will really start to look at how this develops over time. So on to our clinical trial. We are in the second year of this, and this is funded by the National Institutes of Health, mostly by the NICHD, which I know it says child health, but they are really interested in looking at human-animal interaction in all populations, as well as the complementary and integrative health arm of the NIH. So this is a government-funded research project. And this is what our timeline looks like. So we recruit and screen in month 1. They then complete their first baseline study period, which occurs over a 2-week period. And then 3 months happens with nothing, and we follow up and do another study period 2 weeks later. So this study is what we call pseudo-randomized, which means that veterans will either get a dog now or later. We can't truly randomize because that would be entirely unethical to not give a veteran a service dog. So some will get a service dog at baseline, and then we follow up with them 3 months later. Some we'll follow up with them without a service dog, and they'll get one later. So that is our control group, is that waitlist control. And we hope to have 50 veterans with the service dog complete the clinical trial, and 50, like I said, that remaining on the wait list during the period. We are also including spouses in this, following spouses before and after they get a service dog in the home as well, to look at what I was talking about before on those indirect and direct outcomes on the spouses. So this is a huge endeavor, and we are doing a lot more this time around. So the first thing we're doing is that we are still getting self-reported PTSD, but we're also incorporating clinician blinded ratings of PTSD. So the clinicians do an interview, an hour-long interview. It's called the CAPS, the Clinician Administrated PTSD Scale, and they are blinded to whether the individual has a service dog or not, which gives us a little bit more control over the actual PTSD that they have. We're also doing cortisol. We're doing more samples over more days. And as mentioned earlier, we're doing this before they get a dog and after to see how it changes. Again, we have 1 million measures in our online survey. We also are using a new technology that allows us to randomly check in with the veteran up to 4 times a day. So this is Again, another way to kind of get more control over self-report. Usually when we ask about things like depression in a clinician-administered scale, we ask, in the past 2 weeks, how often have you felt X, Y, and Z? Which is okay, but it's a little bit better to ask in the moment, how do you feel right now? And to look at that over a 2-week period and then look at that again 3 months later. So the check-ins ask about how they're feeling. They also ask if you have a service dog, how you're using your dog, if you're with your dog. And we're doing that with the spouses as well. So spouses are paged and asked, how are you feeling? How's your day going? How's your family functioning today? We also have a wristband that's measuring sleep objectively. So if you remember in our first study, we had self-reported sleep. So veterans with the service dog tended to report that they slept better and that they felt more rested when they woke up when their dog's sleeping in the same room with them. Now we can actually verify that through a wristband. So very similar to Fitbit technology, it basically just gives us a report of how effective their sleep is over time. And that's what the data looks like. So we have light levels and movement, and we have that actually 24 hours a day. So we're able to look at sleep, but also how often they're walking the dog and how often they're getting out. And then last but not least, we have a dog actigraphy measure as well. Many of you probably have heard of the whistle. It is an accelerometer for dogs. So we're able to look at the dog's sleep, how that links up with the veteran's sleep, and the dog's activity over time. So that is our clinical trial. And just a quick plug on our research group. We do a lot of service dog research. So obviously this is our PTSD, but we look at dogs in hospitals. We're looking at mobility and medical assistance dogs. And we are starting an arm with autism service dogs as well. So happy to chat about all of our research, and thank you very much.
Wow. Well, that's why they get the press. Okay, well, thank you very much, Brett and Kerri. Our final study is very different. It uses eye tracking, or it used eye tracking to measure the effects of another clinically based program that teaches veterans in treatment for PTSD how to train service dogs for another veteran, the Paws for Purple Hearts program. Matt Decker, there you are, sorry, oh God, my glasses, will take us inside this 6-week-long program. Thank you, Matt.
Hello. Is this thing on? There, whoa, there we go. Good morning. All right, so we don't have much time, so I'm gonna stand up so I can see most of you in the back, and I know most of you in the back are going, wait, he's standing now? Kind of a short guy. Hi, everybody. All right, so I'm not going to describe our application process because frankly, it's very comparable to everybody else's, and I'm sure you're all acutely aware that we don't need to hear that again. So what makes Paws for Purple Hearts program at the Palo Alto VA special is the fact that the dogs will actually go overnight with the veterans. So we have a 6-week program. The veterans self-select into the program. They can opt in. So the veterans will, they're at an inpatient facility at the Menlo Park VA or at the Palo Alto VA, and what they will do is they will take an optional course during their lunch hour to learn what we call service dog training canine assisted therapy. So they will come to us at our canine corner at the facility, and they will learn canine learning theory, the commands, how the dog's thinking, and obviously they get all of the fun impact of the canine-assisted therapy. When they're finished with that, they go back to normal scheduled mental health from the VA. And again, so it's inpatient, so the mental health programming is all day long. So that's the real basics. Now, I want you all to do something for yourselves because I've been 2 things in my life, a Marine and a social worker. So right now you get the social worker. So I want everybody to look up from their phones. I got some of you with that one. All right, do me a favor. Everybody take a big, deep breath. Much better. I need to key you up for Steve because Steve's an interesting guy and I want to make sure you guys pay attention to this one because this is a really different approach. but it's going to give you a different perspective. And as a final message, I want you all to know that there are a million different ways to do this, and there are a million different ways to do it right, but there's really only one way, and that's to fail. And I don't see any of us here at this conference failing. So, without further ado and saving as much time as possible, Steve, you're up.
Thank you, Matt. Thank you, Meg. I'm Steve Woodward. I'm from the National Center for PTSD. And I've actually spent most of the last 20 years doing research on sleep and brain structure in PTSD. And as happens sometimes, an RFP came out from one of our funders, the Military Operational Medicine Research Program, asking for people to do research on the impact of dogs on veterans with PTSD. So we applied, and we're lucky enough to get funded. And the headline of our grant referenced cardiac autonomic reactivity in PTSD because this is the most medically consequential impact of canine companionship that we could find in the literature. That is really possible role in reducing heart disease. But I'm going to show you data on social cognition as well, which was also a major feature of our project. So I always like to show this slide. This group doesn't really need to see it. This is about an 18,000-year-old cave painting illustrating the long relationship between humans and dogs. And what I think is very important from the perspective of PTSD is that these were two competing predator species that became friends. And they did so only by virtue of a fear reduction process that was mutual, and fear reduction is what PTSD treatment is all about. So that's why I think it's very interesting. Why I think it was great that the military funded this study and that this group is working so hard to pursue this kind of work. So I want to tell you about two groundbreaking studies from Uppsala University, where they have a group that is studying the impact of dogs in huge samples. In 2017, this group published a study on 3.4 million Swedes who did or did not own dogs. And the reason they did or did not own dogs is because in Sweden, dogs are also registered. So people have people numbers and dogs have dog numbers. So they were able to go into that data and determine that for individuals living alone, say not in a family, but living alone, those that also had a dog exhibited a 33% reduction in all-cause mortality over a 12-year follow-up. That is an enormous effect. The next year, the same group published a study on 35,000 twin pairs. This is a famous twin study, the Swedish twin study. What they found was that dog ownership is heritable. That is, monozygotic twins or identical twin pairs are more likely to both own dogs or both not own dogs than fraternal twin pairs. The heritability of dog ownership is pretty high. It's about the same as a good personality measure. So the implication of this is that the effect they saw in their study they published just 1 year earlier could have a genetic basis. That the people who had lower all-cause mortality could well have had that whether or not they ever had a dog. So this is why it's important to do that our study designs take these possible sources of contamination into account. We need, at this point going forward, to be doing a random assignment or within subject designs to make sure that our results are not contaminated by uncontrolled selection biases. So our study is a within subjects design and made possible by the fact that we are operating within an extended inpatient program. The inpatient stay at our PTSD program is about 90 days. So the 6 weeks that Matt talked about are a subset of the time in the program for most patients. And our goal is to provide policymakers with the best data that they can get going forward. As you may know, this is a big issue in the VA, and it's a very fraught issue because some of the models that have been proposed for making service dogs available to veterans are extremely expensive, and the VA is pushing back very hard on this for financial reasons. I should also make the same disclaimer we're all supposed to make. These are my opinions and not the official positions of the VA or the DoD. So our participants, as Matt was saying, were in the program. They elected to participate in the service animal training intervention, and these are fantastic dogs. The Labradors, very like the dogs we have here with us today. And the key feature of the intervention is that they manage dogs in pairs. So roughly 1 week on, 1 week off. Our subject will have a dog 1 week, not have a dog the next week, and so on. When they have the dogs, they have it 24/7. All night, as Matt mentioned, they take it to all their treatment groups. Sometimes they take them to medical appointments. When they don't have the dogs, they really don't have them. Their co-trainer has them, and we were careful to make sure that co-trainers never boarded in the same rooms in our inpatient program. And given that design, we measured not only eye movements given in front of certain stimuli, but we measured everything we could. We also measured sleep, we measured mood throughout the day. We brought them into the lab, we measured startle, attention bias, and social cognition. So this is the consort diagram that everyone makes us include in our papers these days. There's one important number here, and that's 47. That's our sample size at this point. Dogs make people happy. So that's finding one. This is ecological momentary assessment data. That is data that was gathered during the day using an iPod. So when over the course of the 4 to 6 weeks that patients had their dogs, we asked them 4 or 5 times a day to endorse positive or negative mood states, and we have a very strong effect such when patients are with their dogs, they are more apt to induce positive mood states and not endorse negative mood states. Now, this is a study that Meg was referring to. This is published in PLOS One. On the top, you'll see a representative stimulus from this task. We would present these pairs of faces. This is the same actress providing different emotions, a neutral emotion, and in this case, an angry emotion. And the dots you see are gaze tracking. So we throw the slide up and we basically just see where the patient looks. There's a cover task, which is simply to tell us whether it's a male or a female. So it's very easy. So as you can see, there's a large effect in favor of the emotional face. People are inclined to look at emotional faces more than neutral faces, and particularly negative faces in our patients, and this has been replicated recently in another laboratory. PTSD patients are very attuned to angry faces. They spend a lot more time looking at them than even at fearful faces, which was interesting. Unless they have a dog. So if the dog is in the room, they are much less likely to spend time looking at the angry face. And when I say in the room, they're more or less like these dogs are. They're not on anyone's lap or interacting with them. They're lying next to the patient, asleep typically under a bed. So this is not an effective distraction or interaction. It's something about just being near the dog or having been with the dog for the prior day or two. This is it's a nice effect for a PTSD patient, I think. Another task we do in the laboratory is something called the reading the mind in the eyes task. Now, this is a famous task developed by Simon Baron-Cohen to study social, facial emotion perception in autistics who do very poorly on it. So the task is simply to look at the eye image, of which there are 36, and pick the right word there's 4 words provided, and the task is to pick the word that corresponds to the emotion. And again, we track eyes, we track gaze to both the face and the words during the performance of the task. And of course, we have whether or not they got it correct. Oh, is there? Oh, I don't know any. Oh, I see. Okay, thank you. So we're skipping that slide. So this pair of slides is sort of for Meg. I'm going to ask you to, I'm just going to go back and forth between these 2 slides a little bit. So if you read the title, you'll see that this is the effect of dog in session on perception of facial emotion. This is the effect in a separate sample of oxytocin on the perception of facial emotion. So they're looking like the same effect in these 2 samples, which was a pretty neat finding. But there's a kicker here. So if you look over on the right panel, these bars represent the range of values associated with the range of values over the sample of percent correct as a function of whether the dog is in the session or not in the session, or whether oxytocin is on board, is on board here or not. And what you'll notice is that they actually did worse on this task when the dog was in the session or when they had oxytocin on board. So how could that be? Well, it turns out that there's a lab in Ontario run by a fellow named Mark Sabog, who has looked at this reading the mind in the eyes task in depressives. Turns out that depressives do better on this task than non-depressives. And by the way, our patients are doing fine on the task. They are not impaired on this task at all, notwithstanding their vocabularies or what we might infer about social cognition and PTSD. These guys are doing great. But what Sabog found is that if they made their depressives feel better with a mood induction, they actually did worse on the task. So I think there is an answer to the mystery, though. And it's, I think what we've got here is a measure of trust. And so we know they're feeling better. And what we're seeing, I believe, is that when they're either with their dog or on oxytocin, they are less concerned about interrogating the faces of others to obtain information about the emotions that person is feeling. They're feeling better, it's all good, and they're just less concerned about the implications of the emotions of the people they're interacting with. And that's maybe a word, I propose that trust is the word for that. Now, just a quick word about sleep. And I'm a sleep researcher, and we measured sleep very carefully in these patients using actigraphy and the morning assessments for both sleep quality and nightmares. And I'm sad to report to you that we have found no effects on sleep in these patients. We'd expect improvements, but in the context of inpatient treatment and sleep on the wards, we have not seen effects. Now, we've had some interesting conversations with Rick Yount and others today, suggesting the fact that these patients are not allowed, that dogs are not allowed to sleep on the beds may may play a role in this. So there may be an asterisk on that finding, but so far we have not seen effects on sleep. And I think it's important in this effort to keep in mind if there are things we don't find, that in a sense strengthens the results we do find. In a way, we don't want to find everything. We want to cast a wide enough net so we can discriminate between where dogs are helpful and exactly how and for whom and where they're not. And this enhances the credibility of the whole enterprise. So that's sort of a positive spin on this finding. We do see an interaction between time and sleep heart rate, which is a little interesting. So this is heart rate over the night, which goes down in all of us. And you'll see right here that if the dog is next to the bed, sleep heart rate doesn't trend up in this pre-arousal period the way it does normally. And that's not uninteresting, because this period of the pre-arousal period is a very important one. That's when cortisol starts to rise. That's when our bodies start getting geared up for the day. Blood pressure goes up, and stroke and cardiovascular events occur preferentially during this period of the day. So the fact that there is that little heart rate effect may not be completely insignificant, but it is fair to say that it is small. This is heart rate throughout the day. We collect this through a single patch ECG device. Corrected for activity, it is slightly lower throughout the day when people have their dogs than when they don't, but it's a small effect. It's less than 2 beats per minute. So in sum, we're seeing the canine companionship is associated with some nice effects on a bias to attentional bias to facial, social emotion projections from faces, reduced response to anger, reduced interest in anger, and an elevated index of trust in, but the cardiovascular benefits are unclear at present, and more research needs to be done on that. So I'm very happy to hear anyone's ideas about how to extend these kinds of designs to folks living outside of an inpatient treatment program, because I think that's where we have to take this kind of work. Thank you very much.
Thank you very much. Okay, well, thank you, everybody. And now we're going to talk amongst ourselves in the panel, and we'll be opening it up to questions, because we're doing great on time, which I'm thrilled about. So we have a microphone there, and I just wanted to say, since we're doing well on time, if anybody thought that there was something like that moment after the party when you say, why didn't I say that? You want to say it? Is there anything that you wish that you'd had a chance to say?
I'll think of it tomorrow.
You'll think of it tomorrow. Or 3 in the morning, everybody will be available at 3 in the morning for those afterthoughts. Great. Okay, well, I have some questions. I wanted to ask you, let's see, maybe I'll use this and you guys can have that one. Bahesha, in your paper, there was a mention that you use some other, I'd like to know, I guess, clinical interventions that you do now that Richard isn't there. Who is performing things that have clinical significance in your program?
I was thinking this was an intelligence test right here. We have Dr. Perletta Saxon, who is working with us at this time.
Great.
And just for what it's worth, we have the study ongoing and adding other measures that we're studying as well. So we have the preliminary information on that, and it will be completed and also be conducted on our next upcoming class in the spring.
Okay. Oh, excellent. Very interesting. Well, I do just want to say, and just in general, I hope that one of the takeaway messages for all of you out there is, if you have your service dog training program, certainly there's evidence here that you have a very powerful window to not just train and place service dogs, but to make a significant impact on jumpstart on the healing process of the veterans who are coming to you to learn the handling of those dogs. And that's one of the things that we'd like to keep thinking about is, what can you do to make your program as effective as possible to hit every note that you can in the training of service dogs? Another question that I had for who was it that, Kerri, your program, they only allowed no more than 2 dogs at home for inclusion in the study. Anybody have any ideas on why pet dogs are not as effective as service dogs? I mean, this is what you see, and it's part of the VA study now, is looking at, well, emotional support dogs, but really what they're talking about are just maybe trained pet dogs, that people have dogs, but they're not finding them as effective as a service dog. So how does having a dog at home skew these numbers that you would be finding, or in the future or in the past here? Any thoughts?
Yeah, I don't know the answer to that question. I think it's a study that is remaining to be done. Hopefully the VA study will give us a little bit of context about how they might differ. We did try to look at those on the wait list with and without a pet dog and see if there's anything different: sleep, anxiety, depression. We didn't have the best sample size to do that powerfully, but we didn't find any sort of differences. So presumably those that are benefiting from a pet dog at home may not be then going to apply for a service dog. So we might have already had a bias sample that those who had sought out the service dog may not have been getting clinically meaningful benefits from their pet dogs, but we really don't know, and I think it's a really important question that hopefully we can start to get more clarity around. But.
All right, well, you're not off the hook yet. I have one other question from another paper that Kerri did. They measured the human-animal bond through a 1-question measure called Other in Self.
Yeah.
Which is something that sounds really easy to do. So I thought that this might be something that when you're out there even asking about pet dogs, like how many pet dogs do you have at home, and giving them this other in self measure to see what the pet dog means to that person, and then do the other in self for the service dog after the training period, and then a follow-on if you're lucky enough to get follow-on opportunities. So can you just tell them quickly about other in self?
Yeah, so we're inherently psychologists at training, and in psychology we have a lot of measures to measure interpersonal closeness, so how you feel with your child, how you feel with your spouse, and the iOS is one way to do that. And it's one question, and it's basically just Venn diagram-like circles.
Wait, I have a picture.
Oh, you have a picture. But yeah, measuring the bond, there's a billion ways to do it. There's ways to do it in 40 questions. There's ways to do it in 10 questions. You can ask qualitatively to describe the bond, but that's a really good way to do it in 1 question, and I'd encourage anyone who is wanting to gather data to use it. It's really easy.
I just was so impressed that it was only one question. We don't get that opportunity very often, do we?
Yeah, it's a good measure, but it's adapted from psychology research from largely spouse relationships, so
Yeah.
it mirrors really closely with dogs.
Steve, I thought your point taken about that domestication is basically fear reduction. I mean, it's the conquest of cooperation over fear. Mm-hmm. And that is the basis of why the dog is the ultra domesticated animal for humans, and why the dog has the potential to be the most effective at appealing to those fear systems in the brain and boosting the social brain networks that are damaged. Anybody else, now that we're talking, anybody? Richard, I know you had something you wanted to add to your findings.
Well, you cut me off quickly, and I didn't get through my...
Well, you want to tell...
Can we get back to
some...
my slides? Do you know how to do that?
Oh, God, no. Oh, wait, maybe I do.
Just try back in the heck.
No, they cut us off. They cut us off.
Forget it. I would need the slides to show.
All right. Are we... Question. Hi.
Hi. Quick question. Thank you for the panel for presenting, and it's wonderful to see the different study groups and universities link up with our programs. When you were talking about our programs helping the veterans through the training process, have you studied, or would you be interested in studying different training methodologies? Because in the dog training communities, some groups still use physical corrections on the dogs. They use pinch collars and things to that effect. Some do not. And I wondered if that can impact the veterans' experience as well.
Kerri, you want to take that one since you did the study already?
Yeah, we've published a little bit of that. Again, not much has been done, and it's pretty preliminary. So again, I think the answer to a lot of our questions is that we need more research. But we did look at pretty much what the veterans are doing on a daily basis as far as ongoing training and how that relates to PTSD in the bond. And so we can talk afterwards and I can send you that paper, but that was in collaboration with a veterinary canine behaviorist who looked at the dog's behavior in the dog training. But essentially we found that veterans use a wide range of different types of positive reinforcement at home, and that there is some relationships, but not overwhelming amount with PTSD, but really where we found relationships with the bond. So the more often they played with the dog and had verbal and physical reinforcements in their lives, the higher the bond. So,
right, I was just asking about if they're taught to use corrections where if the dog makes a mistake, you kind of pop it on a choke chain or a pinch collar, those sorts of things. If you don't understand, I don't know if you're aware of that type of terminology or if we're not communicating well. Yeah, positive's great. I just didn't know if the rest of it has an impact on the veterans' experience or not.
I don't think that's been extensively studied yet.
Okay, thank you.
You know, we're out of time. But we're going to lunch, everyone, and if anybody wants to come up and during lunch and kick around some ideas, we'd love it. Whoa, hold it. Chris is not letting you go yet. Wait. Good. Sit. Excellent. All right. Stay. Down. All right.
Okay, all right. Just a few announcements, because this is the last time that we're all in the same room together. So just a few things. The feedback last year was people requested more time to network with each other. So this year, we are putting signs out during the lunch hour that if you would like to talk about a particular topic, please feel free to sit down at that table and then have more informal conversations with the people around the table about that particular topic, just as an opportunity to talk with other programs, get to know maybe some best practice or things they enjoy with their program around that particular topic. So that's available to you. We do have a very short, tight schedule, so it's only 45 minutes for lunch, so don't wander too far. And then this evening, we've got the regional chapter meetings. Those rooms are assigned in your schedule. But the committee meetings, the committees wanted to meet face-to-face while they had the opportunity to. So those are for committee members. However, if you are somebody interested in a particular committee, you are welcome to attend as observers only. And those room assignments, if you want to write them down, there also will be signs on the doors. But the Standards Committee is meeting in Creekside B. The Creekside rooms are down the hall to your right. Membership Committee, they're meeting in here in one corner of the room. The Marketing Committee is meeting in another corner of this room. And then the Education Committee is meeting in Creekside A. So feel free to drop in and learn what's going on. Yes?
Following the schedule, because I want to know if the breakout is starting at 12, oh, you turned it on, 12:45, or because we're not on schedule.
Let's start at 1 o'clock.
Thank you.
All right, before we draw the raffle, I'd just like you to thank our panelists here today. Thank you very much. And just one more piece of news. The hotel is allowing us to use the grass out the front of this building for the doggy toileting area. You don't have to go right out the back, so just out the front of this building. And the lucky winner for the bold lead designs, is Jerry Lynn Luloff. Jerry Lynn Luoff. Oh, there you go. Great. Thanks. Enjoy lunch.